Welcome to the fourth of our 7 modules on value-based healthcare and creating a culture of stewardship. On the revolution that's needed to ensure that universal healthcare is sustainable. Now, we've tried numerous things in the past to deliver healthcare. We saw in 1948 the introduction of a bureaucracy, and it was vitally important at the time, replacing the chaos of private practice, which had an adverse effect on poor people. And the bureaucracy changed from time to time, from regions and districts and these sort of organisations, and still changes. But healthcare is too complex for a bureaucracy alone to deal with it. Then in 1990, we saw the introduction of the market. But the market didn't solve the problems either. What we need is a much more radical approach, a 21st century approach. Now, these 7 modules start off with 2 modules on key concepts, on concepts like value and stewardship and waste and outcomes. But these should not be seen as theory modules. They are of fundamental importance because changing the way people think is what's needed for the revolution. Rewiring the brains is what it's called, so that people all know what is meant by systems or stewardship. They think the same way, they feel the same way, and they behave the same way. So those first 2 modules were of vital importance, both for you as a learner on the learning programme and thinking about the people you meet at work or you're responsible for. How do you rewire their brains? Then they can move on to the more practical sort of steps. The 5 modules for people in leadership and management positions, most of whom are also clinicians. The first of those modules was on thinking in population terms, population segments. People with respiratory disease, people with cancer, people in the last year of life. This second of the 5 modules is on systems. Then the next one is on networks. The one after that on personal value, and finally a module on culture change. So systems, it has been said that the 21st century is the century of the system and the network. The 20th century was the century of the bureaucracy. And this is largely due to the work of Oliver Williamson and Elinor Ostrom, who got the Nobel Prize for Economics in 2009. A system is a set of activities with a common set of objectives, and each population segment needs a system. Part of the revolutionary impact of the white paper, and I don't often say that, but I regard this change as one of the 3 most significant changes in my lifetime, along with the NHS Act of 1948 when I was 4 and the market in 1990. This introduces integrated systems, and the word system is mentioned 251 times, whereas the word hospital is mentioned 21 times. That's not to deny the importance of hospitals and health centres and mental health trusts, but systems is the new way of thinking. And the paper identifies 4 purposes for systems. 1 is improving population health and healthcare. Not just the quality of care for the patients who come, but population health and healthcare. And population is mentioned 42 times. Secondly, tackling unequal outcomes and access, tackling inequity. Thirdly, enhancing not only productivity, but also value for money. And fourthly, perhaps the most interesting, is helping the NHS to support broader social and economic development in the population it serves, and remember, the population that provides the resources for the NHS. Developing local job opportunities, helping people from local housing estates aspire to become clinicians, for example. So, this is the module on systems. The next module is on networks, to deliver the system. The one after that on personal value, which systems have to take into account as well as population value. And then finally one on culture change. So, let's learn about systems for value-based healthcare and the culture of stewardship.